what we're always told, I guess, going through, medical school and still an awful lot of people believe that weight loss is pretty simple, really. It's just a matter of less calories out than calories in. So the whole sort of calories in, calories out sort of theory, it's just about calories. And if only it were that simple, hey?
Well, I mean, it's complete and utter nonsense. And the problem is, the reason it's been able to get so much traction is because it is actually based in fact. It's actually true that for you to gain weight, you actually have to take in more calories than you're burning. It's a simple matter of calorie balance. But why it is complete nonsense is it describes the problem, but it doesn't explain the problem. So what do I mean by that? Somebody who's gaining weight, yes, they're consuming more calories than they're burning. But why are they consuming more calories than they're burning? And this is what is missing from the conversation. This is why the whole calories in, calories out does not work. It doesn't help us deal with obesity because it doesn't explain the problem. It doesn't tell us what to do. It just tells us what it is.
Okay, well, I've got a feeling you're going to now explain why it's not important, or why there's other issues involved.
Well, I mean, look, you've been a doctor, you've interacted with thousands of patients, and you've spoken with lots of people, and you know what the typical patient experience is when they go to a doctor. They go to the doctor and they say, "Doc, I'm having trouble losing weight. Can you please help me?" So as a doctor, what do? We invoke sins. We say, gluttony and sloth. You're lazy. You're greedy. It's all on you. Because it's a matter of calories in, calories out, we assume that's entirely under your control. All you have to do is eat less and exercise more. And if you can't do that, that's on you. So we're basically gaslighting the patients. That's all the calories in, calories out myth is an excuse to put the blame onto the patient for something which most certainly is not entirely in their control. So have you ever heard of the thyroid hormone? I'm guessing you've done a medical degree in that 1800s or something. You've probably heard of it. So we all know that if you have an underactive thyroid gland, that can lead to weight gain. So what is the thyroid hormone? It's a hormone in the body. So we know that if we alter this particular hormone, we can affect our weight gain. What about a condition called Cushing's syndrome? We associate it with these very unflattering terms, moon face and buffalo hump, which is basically, references to the abnormal distribution of fat that we get with this condition, with Cushing's syndrome. What is Cushing's syndrome? It's when you have too much of the stress hormone, cortisol. It is absolutely without a doubt that too much or an imbalance of certain hormones will cause weight gain. And the fact is, without a shadow of doubt, the king of obesogenic hormones is insulin. And, this hormone drives fat storage, and it also impairs our ability to burn energy. So, you've had type 1 diabetic patients, I assume, Peter?
Yep.
So how do they present? So let's talk about a type 1 diabetic patient. They do not have enough insulin on board. Their bodies actually don't make enough of this hormone. And we do need some of it. Without it, we die. It is still a very important hormone. So if somebody's body's not making insulin, how do they present?
Well, with weight issues usually. Yeah.
They're emaciated. They're fading away. They're literally starving before your eyes. No amount of food that they can eat will stop them from starving to death. Now, that's an extreme example, but that basically speaks to the point that without insulin, you don't gain weight. And a lot of type 1 diabetics, they actually know, and I've spoken to several as patients, who, when they start the life-saving insulin therapy, they notice that their weight increases substantially. So much so that a lot of them actually deliberately underdose with their insulin because they know they can stay skinny if they do that. And if they take the prescribed amounts of insulin that their doctors would have recommended, they'll often get they'll develop obesity. So we absolutely know the ability of insulin to gain weight. And most type 1 diabetics, they have to pick an area of their body to inject. And one of the most common areas we tell them to inject as doctors is actually down in the lower abdomen down here. And what will happen if you inject in the same site long term with a large amount of insulin, that will stimulate localized fat accumulation, something we call lipo, meaning fat, hypertrophy, meaning excessive growth. And the lipohypertrophy in the lower abdomen often resembles breast tissue. It often looks like breast. That's how localized and significant these fat accumulations under the action of insulin are. And so I guess then the question is, well, how does insulin do this? And well, it does three important things. And I want you to look at this through the lens of calories in, calories out. Because as I said, calories in, calories out describes the problem. It describes what is going on, but it doesn't describe why. If we look at it through the lens of insulin, we can begin to understand the why. So insulin does three important things. First of all, it gets fatty acids in the bloodstream and it pushes them into fat cells. It takes sugar in the form of glucose in the blood and pushes it into fat cells. And these fatty acids and the sugar will combine together to be stored in the form of triglyceride fat. So there's two steps. And the third step is to absolutely inhibit any ability to actually burn that stored fat. So if you think about this in the context of calories in, calories out, we can see that the insulin actually forces the energy into the fat cells, and it also stops it getting out. So of course, if you have an excess of insulin, you're going to end up with this imbalance between calories in, calories out. But now we know why. It's because of the insulin. Now, I guess the question is, what increases the level of insulin in our body? And I know you know what this is.
So, indeed. Well, I think that's the obvious thing is we know that insulin is secreted in response to ingesting carbohydrate.
Exactly. So for the same amount of calories in a given food, carbohydrates will release about twice as much insulin as will protein, and much, much more insulin than an equivalent amount of fat. So we know that if you're on a high carbohydrate diet, and I guess what kind of things are we talking about with carbohydrates, Peter?
Well, there's two types, isn't there? There's the sugars, and that we see in, soft drinks and so on. And then there's the starches, which are broken down into glucose and absorbed. And therefore, the only difference between the two is that one takes is a bit slower to be digested and to respond. But it's still all
based on sugar in the blood.
Yeah.
And we often assume, we use the term complex carbohydrates to refer to the starches under some misguided notion that they're somehow magically healthy and they don't turn into sugar. Mm. So you'll remember the study that Ludwig did, where he said, okay, well, if insulin and carbohydrates and so on and so forth is so important, he put people on low carb diets and compared them to subjects on high carb diets. And he found that the differences between the two at either end of the spectrum was 300 kilocalories a day of energy expenditure. So the subjects on the lowest carbohydrate diets were burning an amount of energy that was equivalent to riding a bike for an hour a day. And this is without any exercise. What it meant is that the subjects on the low carb diet basically were burning 300 kilocalories a day extra for free without any extra effort.
What's the explanation for that, Paul?
Well, because when you eat less carbohydrates, the body releases less insulin. And remember that insulin promotes fat storage. It pushes energy into your fat cells and it doesn't let the energy escape your fat cells. It basically keeps it there. So again, think about this in the context of the calories in, calories out hypothesis. So by going on a low carbohydrate diet, you're able to lose that much extra energy. And here's the kicker. These subjects did this without any compensatory increase in their appetite, which, by the way, almost always happens. Ever heard the term working up an appetite? So so this whole thing is like, calories in, calories out. If we just look at it simply from the perspective, well, you just need to exercise more. Well, half of the people who are going to exercise more are going to find that they're going to be hungrier, and they're going to have even more difficulty in regulating their appetite. Whereas simply by eating low carbohydrate diets, the subjects in this study were able to increase their energy expenditure without any need to increase their energy intake.